So I'm here with Dr. Nate Handley, who's a very unique physician in that he's board certified in internal medicine, medical oncology, and integrative medicine. He's the director of the Cancer Recovery Program at the Marcus Institute of Integrative Health, which is part of the Department of Integrative Medicine and Nutritional Sciences at Thomas Jefferson University. And he also is co-director of the Precision Medicine Program. So Dr. Handley, welcome. And tell us a little bit about precision medicine. There's a lot of interest in it. People are searching it, they're looking it up. But how would you define precision medicine for the average person?
Yeah, I think that's a great question because a lot of people are talking about precision medicine right now. It's a very popular topic, and sometimes it's a little bit unclear what it is. But when I think about precision medicine, what I think about is taking a patient, taking a person, and creating a treatment plan for them that is individualized. And it's individualized based on genomics, based on biomarkers, and potentially based on wearable devices too. The idea is that you take a person, you kind of create a picture of how they're put together, create a story for how their life works, and then you create something that is very specific and targeted for that particular story, for that particular person.
So it sounds like you start off by trying to understand the blueprint of the person.
It's really about understanding what makes this person unique and what are the things that are going to be most impactful for that person. Because not everyone's put together the same way. Different people may come in with, the same complaint, and the root causes for that complaint may be totally different for different people based on the person's blueprint and how things are showing up in their life.
So what makes this approach new, different, more precise?
I think the difference here that's really exciting is that we're not kind of shooting in the dark when we're thinking about treating a particular condition or when we're thinking about, making dietary recommendations or supplement recommendations. We're making decisions and recommendations that are very precise. They're based on the specifics of a person's genetics, the specifics of their blood work, the specifics of the data that they're generating from wearables, potentially. And so we're not just saying, hey, maybe you should try this supplement. We're saying, these are the reasons that we think this is an approach that would make sense for you. Let's try it, then let's monitor it over time and see how it's working, and then we can make adjustments. And so the precise piece is that it's data-driven. It's not, one-size-fits-all medicine anymore. This is medicine that is really, it's for the individual.
Who is this precision medicine model for? Is it more beneficial to some people versus others?
That's another great question. And so I think of precision medicine as really good for a couple types of things. One is for preventing disease. So if you can understand what someone's predispositions for disease are, which is something that precision medicine is actually quite good at doing, then you can make some changes that might reduce the risk of developing diseases in the future. So for example, you may find that someone has an increased risk of developing diabetes or having difficulty managing blood sugar over time based on certain genetic markers. And if you look at their blood work, maybe there's no evidence of that happening. But you may see that, based on current dietary patterns and looking at the person's genetics, there's a real possibility that they may develop an issue in the future. And so, it could be for someone who's healthy but is interested in reducing risk of disease in the future. It can also be for people who are dealing with a specific condition. Say someone has fatigue and they don't know why they have fatigue. Fatigue can be caused by many different things.
So they've gone to their primary care doctor, they've had the basic blood panels, and it's unclear.
And so what we do is we have more lenses that we can use when we are thinking about someone from a precision medicine approach. We look at the picture more broadly, but also with more depth. And so this is where the precision piece comes into play. We get a lot of data, and so we can look at questions from more angles than you would be able to otherwise. And so really it's an approach that's reasonable for anyone. It's good for people who are interested in preventing disease. It's good for people who are interested in managing a disease. And it can also be good for people who are interested in optimizing different aspects of their life, whether it's their nutritional profile, whether it's their exercise regimen. It may be people who are interested in longevity and kind of enhancing their health span in addition to their lifespan. And so it can check the box for a lot of people.
So I can really see an advantage for people who may have hit a wall in either understanding their illness or getting better from it.
Mm-hmm. Yeah, I think that's a group that we see a lot. People who really want something that they haven't been able to access so far. People who maybe feel frustrated that, they come in with a condition and that there's an algorithm that people follow in treating them. People want to be treated as a person. They want to be understood. And that's what a precision medicine approach allows us to do. It allows us to look differently. It allows us to think deeply about a new condition.
Can you give us an example from your practice of how this precision model really was advantageous for you and the patient?
So one example that comes to mind is that we often have people who are interested in how best to eat, what their optimal diet is. And we had one person who came in and we did some genetic testing, and we found that this person had a particular gene variant that put them at significantly higher risk for developing Alzheimer's disease. And so the gene is called ApoE, and the particular variant is ApoE4. And so if people have 2 copies of this gene, everyone has this gene, but there are different variants of it. So if people have 2 copies of the gene, their risk for Alzheimer's disease can increase by 12 to 15-fold. So a huge percentage change. What we're beginning to understand with this gene is that it's actually one that is very responsive to dietary and lifestyle modifications. And so people with this gene tend to have more glucose instability, and so we tend to do a more low glycemic index diet. People tend to have more difficulty with fat metabolism, and so we tend to lean more towards diets that are lower, significantly lower in saturated fat. And because of some more difficulty with managing lipids, we sometimes recommend higher doses of omega-3 fatty acids that we would for someone else. And so, these were some very specific, actionable dietary modifications that are relevant for him, maybe not as relevant for someone else without that gene variant. But for him, it was something that he could easily implement into his life, and he could understand why he was doing it. And so he actually, kind of in reflecting, had started to have maybe a little bit of fogginess and maybe a little bit of difficulty finding words occasionally. And we made some of these changes, and a few months later, he was feeling like he was a little bit more clear. It felt like it had changed things. And it may not have been just the ApoE4 piece, but the nice thing is when you make these changes, a lot of other benefits can happen. When you start making these targeted changes, other parts of the body start working better too. And so that's one good example, I think. Another example is we had a patient who came in and was having a lot of fatigue and hadn't really been able to get to the bottom of it. Noticed that they tended to be more anxious, had been on some antidepressants in the past, but none of it had really worked. And we did some genetic testing and some blood work, and we found that this person had a particular version of the MTHFR gene that put them at higher risk for developing deficiencies in folate. And so, in particular, they had a gene variant that reduced their efficiency of a folate metabolizing enzyme by about 70%. And so
they weren't able to utilize folate.
So they weren't able to utilize folate as well. And when that happens...
Which is important for neurological function.
Very important for neurological function. And so when that happens, folate is very involved in a process called methylation, which is a term that has started to become a little bit more commonly used in popular health circles. Methylation is this process that basically allows all the cells in the body to function smoothly. I think of it kind of like the oil in the engine, so to speak. It's not the gas, it's the oil. It's the thing that keeps the machine moving. And so if you don't have enough engine oil, the engine is just not going to work very well. And so, when people have MTHFR variants, they're at risk of not having enough engine oil, basically. And so when people have that gene variant, we then do some blood work, to see if it's showing up for them. Just because they have a gene doesn't mean it's going to have a significant impact on them. But one of the things that we check is something called homocysteine, which is an indication that methylation is not going well. And so for this person, we found they had the gene variant and their homocysteine level was significantly elevated. And so the treatment in those cases is to focus on methylation, to focus on the specific pathway, which is not true for everyone, but sometimes that's the solution. So you can do that.
In this case, what did that mean, focusing on methylation?
So in this case, it was targeted supplementation, focusing on specific forms of B vitamins, a specific form of folate called methylfolate that is easier to metabolize.
Because it's already methylated.
It's already methylated, and so the gene that is involved in methylating folate doesn't have to do the work. Give them the preformed version of the nutrient, which everyone needs this nutrient. This is a change that is easy. It's straightforward. It's well tolerated. And for this person, it actually made a huge difference. Now, I think what's interesting about this case is that that's not going to work for everyone. It only works if that's an issue for that person. And the only way to know if methylation is an issue is to look at the patient with a precision lens, look at their genetics, look at their blood work, see if that is part of their blueprint.
So how is this precision model different than, say, longevity medicine, which is another thing that people are hearing a lot about?
I think they're related. I think a precision medicine approach really informs longevity medicine. If you're thinking about how to optimize longevity for someone, the best way to optimize longevity is by understanding how that person interacts with the world, how that person is put together. So say, for example, you're trying to build a house. You want to build the best house that you can build. It's going to be able to stand the test of time. What you want to do is you want to start with the blueprint. You want to understand how the house is going to be put together in the first place, because that's your starting point. And so this is where precision medicine begins to inform how we think about how to help someone live their best life. You have to understand their blueprint first. Then what you need to do is you need to understand how the house is actually built. And that's when you start looking at blood work. You start looking at biomarkers. And so even if you have a great blueprint, which is where the genetics comes into play, if you're not using the right materials, that house is not going to do well. So this is where we start thinking about what is someone's diet and how is that affecting their blood work. So when you have that blueprint and you have the blood work, then you can then start to understand how to make the house the best it can be.
So in a way, longevity medicine is really kind of the preventive arm of precision medicine.
Yeah, I would say that's true. It's thinking about how to optimize a particular person. And so, yeah, it's really thinking about how you can get the best out of the material that you're working with. Because everyone's starting with something. It's not the same for everyone, but everyone has the capacity to have longevity, to have a long health span. But the things that people need may be different based on, the specific individual. So I would say longevity is really a branch of precision medicine.
Can you say more about the tools that you use in your precision models? So we talked a lot about diet, nutrition. Are there other things?
Yep. So we do testing. So we look at genetics, and genetic testing is a very straightforward process. It's something you only have to do once because the genes you have are the genes that you're born with. But just because you have genes doesn't mean that those genes are going to show up for you in your life. It doesn't mean they're going to be active. And so then we think about blood testing. We think about looking at biomarkers. And it's not just blood. Sometimes there are urine tests too. But we look at what's actually happening in the body. Another way that we can understand what's happening in the body is by wearables. And so we think about devices that help us monitor the function of the body over time. There are things that we can look at, like heart rate variability, which gives us insight into how well the body is handling stress. We can look at things like sleep quality with sleep trackers, and that helps us understand the efficiency and quality of the sleep. We can look at things like glucose. So sometimes continuous glucose monitoring is a tool that can be very helpful for people. One of the biggest things that can affect longevity is impaired metabolic function. And impaired glucose function is a big piece of impaired metabolic function. And so having a tool like continuous glucose monitoring, which lets us see how your body is responding not only to food, but to stresses in your environment, can help us make very targeted modifications to how someone's living their life. So other pieces of the assessment might involve looking at cardiometabolic health. And so one of the best tools that we have for understanding that is something called VO2 max.
Oh, what's that?
Yeah, so VO2 max basically is a tool that lets us understand how efficiently the body is utilizing oxygen. It's a tool that is actually a really good marker for how healthy someone's cardiometabolic status is.
That's the test where people are running on the treadmill with the face mask on. And
And this is
what's happening there in that test?
So what's happening is what you're trying to do is you're trying to get your body to its kind of optimal capacity for utilizing oxygen. And the more efficient your cardiometabolic system is, the more oxygen you can use. And so what we've learned over time is that VO2 max correlates with longevity. The higher the VO2 max is, the more likely someone is to have longevity. And VO2 max is something that can be trained. It can be trained with specific interventions. But the best thing to do before you start kind of making interventions is to know where you're starting. And so someone, in their 30s with a VO2 max of, say, 40 is going to be in a very different position from someone who has a VO2 max of, say, 60. And those two people may need very different interventions. They'll be able to tolerate different things. And so VO2 max helps us understand what the right exercise approaches might be for someone. Another part of the assessment can be advanced imaging. And so we can do MRI scans, for example, that can look at the whole body, can look at the brain, can look at the organs, and this can help us understand if there are any obvious abnormalities that we need to focus on, precisely to kind of ensure that someone has good health in the long term. Yeah, and so this is specifically, we think about not only just an MRI that looks at the structure of the brain and the body, but an MRI that can look at the function of the brain as well. And so there's something called a functional MRI or a PET MRI. This can help us understand if people are having problems with cognitive function. We can potentially target interventions based on what we find on the MRI. It can also help us identify problems early. If, for example, someone is at risk for Alzheimer's disease or some other cognitive decline, we might see that starting to show up in brain findings even before someone has symptoms.
So if someone were to come in for a precision medicine assessment with you at the Marcus Institute, it sounds like they would get advanced genetic testing that would look at genomics, genetic pathways, all those kinds of things that are unique to their blueprint. A lot of the regular labs that they may have gotten before, but also some other advanced profiles in the labs. Mm-hmm. Things like VO2 max that help to look at cardiometabolic tone and things like that. Advanced imaging and neuroimaging of the body and the brain. Possibly information from wearables and things like that. It's a lot of information.
It's a lot of information. And then the real important piece of it is then pulling it all together. And this is where I think it can be difficult for people to grasp precision medicine sometimes, because you can get a lot of data, you can get a lot of information. There's a lot of data out there in the world. What we do is we put it all together. We put it all together in a way that is understandable and actionable for an individual. So, just because someone's talking about methylation on YouTube, for example, it doesn't mean it's going to be relevant for a particular person. What someone needs is they need the stuff that's relevant for them. And that's what we do. We create something that is really personalized for the person who's coming in.
So given everything you've been learning, studying, and applying in this precision medicine model, is there guidance or tips you would give to the average person who's beginning to embark on their own health journey?
People want to feel their best. People want to be their best. They want to perform well at work. They want to perform well at the gym. They want to feel alive. They want to feel vibrant. And that's something that precision medicine is kind of designed to help people do. It's designed to help people find the best version of themselves by understanding how they are put together. And so when I think about the advice that I might offer to someone out there listening to this, I would say one of the things that can be really helpful is starting to starting to look inward, starting to understand your own body. There are ways that you can look at your own genetics, and you can find a precision medicine practitioner who can help with that potentially.
And what about things like wearables?
Wearables can be also helpful tools. You can start looking at your sleep quality, for example. You can start looking at your heart rate variability, which is something a lot of these wearables now track. And these are tools that are available to anyone, and they're intuitive, they're user friendly, and they can help you get onto this path of kind of understanding how to kind of really optimize yourself.
Thanks. It's always a pleasure to talk to you. I always learn a lot.
Thanks. It's a really exciting topic.